In this podcast episode, Peter Attia engages in a discussion with Belinda Beck, a prominent exercise physiologist and researcher specializing in bone health. Their conversation delves into various aspects of bone physiology, the impact of exercise on bone density, and the importance of proactive measures to prevent osteoporosis, particularly in older adults. Beck emphasizes the critical role of exercise in maintaining and improving bone health, particularly as individuals age. Contrary to the common misconception that older adults are incapable of learning new physical skills, she asserts that older individuals can effectively learn and perform exercises such as deadlifts and squats. The systematic training of these techniques, combined with gradually increasing loads, can lead to significant improvements in bone density and overall strength. Beck highlights that older adults are not merely frail individuals. They are capable of adapting and thriving through appropriate physical activity. The podcast underscores the necessity of engaging in high-impact, weight-bearing exercises to stimulate bone growth. Beck explains that activities like jumping, running, and resistance training are essential for promoting bone density. She notes that the mechanical loading of bones is crucial for their adaptation and strength, aligning with the principles of Wolff's Law, which states that bone adapts to the loads under which it is placed. This principle serves as a foundation for understanding how exercise can counteract age-related bone loss. Beck provides a detailed overview of bone physiology, explaining the two primary types of bone, cortical and trabecular. Cortical bone, which forms the outer shell of bones, is dense and provides structural support, while trabecular bone, found within the interior, is more porous and plays a crucial role in metabolic processes. The conversation highlights the dynamic nature of bone, which is constantly being remodeled through the actions of osteoblasts, bone-forming cells, and osteoclasts, bone-resorbing cells. This remodeling process is essential for maintaining bone health and adapting to mechanical stress. The discussion also touches on the impact of hormonal changes, particularly in women during menopause, on bone density. Beck explains that estrogen plays a vital role in regulating the activity of osteoclasts, and its decline during menopause leads to increased bone resorption and a higher risk of osteoporosis. This hormonal shift underscores the importance of understanding the physiological changes that occur with aging and how they can be mitigated through lifestyle interventions. Nutrition is another critical aspect of bone health discussed in the podcast. Beck emphasizes the importance of adequate calcium and vitamin D intake for maintaining bone density. She explains that calcium is essential for bone formation, while vitamin D is necessary for calcium absorption. The recommended daily intake of calcium for teenagers and adults is approximately 1,000 to 1,200 milligrams, and Beck encourages parents to ensure their children consume sufficient dairy products or fortified alternatives to meet these needs. In addition to calcium and vitamin D, Beck highlights the significance of a balanced diet rich in other nutrients that support bone health, such as magnesium, phosphorus, and vitamin K. She stresses that a well-rounded diet, combined with regular physical activity, is crucial for optimizing bone mass during childhood and adolescence, which sets the foundation for lifelong bone health. As individuals age, they naturally experience a decline in bone density, which can lead to conditions such as osteopenia and osteoporosis. Beck explains that this decline is not solely a result of aging, but is also influenced by lifestyle factors, including physical activity levels and nutrition. The podcast discusses how sedentary behavior contributes to bone loss, and Beck argues that maintaining an active lifestyle throughout life is essential for preserving bone density. The conversation also addresses the misconception that bone loss is an inevitable part of aging. Beck asserts that while some decline is expected, it can be significantly mitigated through regular exercise and proper nutrition. She emphasizes that individuals should not accept bone loss as a given and should actively engage in behaviors that promote bone health. Beck highlights the alarming prevalence of osteoporosis, particularly among postmenopausal women. She explains that osteoporosis is often referred to as a silent disease because individuals may not be aware of their low bone density until they experience a fracture. The podcast emphasizes the importance of early detection and intervention as well as the need for education about osteoporosis and its risk factors. The discussion also touches on the role of healthcare providers in educating patients about osteoporosis prevention. Beck encourages individuals to be proactive in seeking information about their bone health and to advocate for appropriate screenings, such as dual-energy X-ray absorptiometry scans, to assess bone density. By understanding their risk factors and taking preventive measures, individuals can significantly reduce their likelihood of developing osteoporosis. One of the highlights of the podcast is Beck's discussion of the Lift More study, a groundbreaking research project aimed at investigating the effects of high-intensity resistance training on bone density in postmenopausal women. The study involved a structured exercise program that included compound movements such as squats and deadlifts, performed at 85% of one repetition maximum. Beck explains that the study aimed to challenge the prevailing notion that individuals with osteoporosis should avoid heavy lifting. The results of the Lift More study were remarkable, demonstrating significant improvements in bone density at the spine and hip among participants who engaged in the high-intensity training program. Beck notes that the intervention not only increased bone density, but also improved participants' overall strength, balance, and quality of life. The success of the study underscores the potential for exercise to serve as a powerful intervention for individuals at risk of osteoporosis. Beyond the measurable improvements in bone density, Beck emphasizes the profound impact of the Lift More study on participants' quality of life. Many women reported feeling stronger, more confident, and more capable of engaging in daily activities. The podcast highlights personal anecdotes from participants who experienced significant transformations, such as being able to lift their grandchildren or participate in activities they had previously avoided due to fear of falling. Beck stresses that the psychological benefits of exercise should not be overlooked. The sense of empowerment and improved self-efficacy that comes from engaging in strength training can have a lasting impact on individuals' overall well-being. This aspect of the intervention is particularly important for older adults, as maintaining independence and quality of life is a primary concern. The podcast discusses the critical role of healthcare providers in promoting bone health and encouraging patients to engage in weight-bearing exercises. Beck advocates for collaboration between exercise physiologists, physical therapists, and other healthcare professionals to create comprehensive programs that address the unique needs of individuals with low bone density. She emphasizes the importance of providing education and support to patients, helping them understand the benefits of exercise and how to safely incorporate it into their lives. Beck also highlights the need for healthcare providers to challenge the misconceptions surrounding exercise and osteoporosis. By fostering a culture of empowerment and encouraging patients to take an active role in their bone health, providers can help individuals overcome fears and misconceptions that may prevent them from engaging in beneficial activities. As the podcast concludes, Beck expresses her enthusiasm for the future of bone health research and the potential for continued advancements in understanding the relationship between exercise, nutrition, and bone density. She highlights the importance of ongoing studies to explore the long-term effects of high-intensity resistance training and other interventions on bone health.